With the first use of the drug, the people usually feel very happy and the effect is very high. But with the using drug for several times, the amount need to increase to feel. But in fact, at the end of the condition, most of people have to increase to very long or very much substance dose, but still they cannot reach the euphoric effect. This is due to what is called the tolerance, and which is occurred due to negative feedback and leading to decrease the number of receptor on postsynaptic, and this lead to much use the dose and much need for more drug to affect this substance and to give this effect, but in fact there is not good feeling. In fact, using the drug for long periods, and we have the fate that most of people, like 2 to 3% die annually using for this substance. 10% of misusers become dependent, and 25% are absentees for 5 years or at least. Tolerance is usually is very quickly, as with use for short periods they can be leading. And for opiate use disorder in DSM-5 classification, the most important symptoms for intoxication, there is the presence of pupillary constriction, and one of the following is feeling like drowsy, loss of consciousness, slurred speech, and impaired attention. So presence of one of these symptoms with the presence of pupillary constriction is due to is manifestation of opioid intoxication. On the other word or other way, opioid withdrawal symptom occur manifested by three or more of the following, and this occur within minutes or days with stopping of drug or reducing the amount of the people taking. Mood disorder or mood change like dysphoria, gastrointestinal disturbance like nausea, vomiting, muscular ache, lacrimation, rhinorrhea, and pupillary dilatation and piloerection. We have two main steps for treatment of opioid addiction. First one is detoxification, and in this way we taking, if the person is using the drug, we can first use as methadone and buprenorphine, and these drugs are the first line to decrease their less. They are also, although they are narcotic drugs, but they are less euphoric effect and have long half-time, and so the withdrawal symptom will become less, and this effect can be used for detoxification of the drug. Other, which is lofexidine, and this drug is recently approved by FDA, and it has short detoxification treatment for people who are abused, especially in mild condition. Once the people are getting through the detoxification stage, we have to go to maintenance therapy. And the maintenance therapy, either we taking drugs which is partial agonist like buprenorphine, or this drug is like substance he taking before and he maintain on, and this is not available in Egypt. And on other way, we can use naltrexone, and this naltrexone which opioid antagonist, and this blocker for opioid receptor. And so people, if they use this drug like substance like heroin, if you take heroin, the effect will not be, and so people who will not feel that the effect of heroin, and so they cannot use again. Other drug is stimulant, and the very common stimulant is amphetamine, which is a street name speed, and this drug leading to usually taking orally or intravenous, and leading to euphoria, increase concentration, decrease the sleep, feeling more energy, mydriasis, and tachycardia, hyperreflexia, and sometimes leading to psychosis. And psychosis in this condition, it is similar to mania or to schizophrenia. And there is several other drugs like methamphetamine, other drugs like cat and al-qat. This cat is present in Yemen and Somalia, and this drug usually people use to maintain in the mouth and buccal cavity and to maintain stimulating. Cocaine is a very strong stimulant drugs, and usually taken by snuffing and leading to restlessness, energy, and a decreased feeling of fatigue, and decreased feeling also for hungry, and there is hypomania, maybe increased tactile sensation, and so when they stop they feeling like substance bug and what is called cocaine bug, which is tactile manifestation or tactile hallucination, which is present when stopping. One of the most important form of the cocaine is crack, which is a very purified and very strong, a very addictive substance of cocaine. Cocaine is very expensive and very difficult to be present. Usually is associated with psychosis, its use. The stimulant drug like cocaine, the manifestation of diagnostic and statistical manual DSM-5 is manifested for two at least of the following. It can be more, but at least to increase heart rate or decrease heart rate, pupillary dilatation, elevation or lowering blood pressure, and respiration, chills, nausea, vomiting, evidence of weight loss, psychomotor agitation, retardation, muscle weakness, respiratory depression, and confusion. And these are sometimes leading to coma. The withdrawal symptom is usually occur within few minutes or sometimes days using of stopping the drug or decreasing the amount. It's characterized by two main symptoms like decreasing energy, feeling fatigue, vivid and unpleasant dreams, sleep changes like insomnia, hypersomnia, marked increase in appetite, psychomotor change, retardation, and agitation.